Hi, I'm Dr. Gary Sachs, and I'm here with Theresa Schmidt. We're both from Sachs Wellness Center. We're going to talk today about the hair loss that many people are experiencing post-COVID.
Yes.
So what are you seeing? What are you finding out?
Seen a lot.
Okay.
And I think most people, if you talk to any of the hairdressers, are seeing a lot of this. It is mostly women that I see, but I think men are experiencing it too. They just don't notice as much.
Mm-hmm.
Men don't have as much hair as women do. So it's different. For them, if it goes down in the shower, it goes down, they don't even see it.
Mm-hmm.
For somebody else with like hair like that, you're going to see a lot more hair in the shower.
Or if you're like me, you didn't have hair before COVID, and you're not going to have it after. So.
Probably not. So it's a really, I would say at this point, it isn't necessarily if it's going to happen, it's when is it going to happen.
Okay.
We are seeing this, it could be a month after, it can be 4 or 5 months after.
Wow.
So it's not a set time. And I think, my own opinion, is what we're seeing is the thyroid is changing where it's spending its energy. There's a lot of damage done in COVID to the lungs, to the brain, to the blood vessels. There's a lot of damage. That's what it was designed to do. So that's what it does. And so to repair that damage, the thyroid takes your energy from the peripheral, just like if you had hypothermia. It takes the energy from the peripheral and puts it in the core. Your body doesn't really care if you have hair or nails or anything.
Survival's much more important.
Exactly.
Yeah.
Exactly. Yeah. So when I'm testing people, like they'll come in and they're like, "Oh man," and I mean, full disclosure, I experienced this myself.
Okay.
I went, "Oh man," and honestly, it was one of the ways I actually knew I did have COVID.
Okay.
And I didn't have symptoms when I tested.
Yeah, I remember
positive.
that.
I tested positive twice, and within about a week of each other, and I had no symptoms at all. But
and how long for you before
it
you
was 3 months.
took 3 months before this started showing
And
up?
it was incredible.
Yeah.
And, I was telling myself, well, maybe it's just because I have long hair, but that wasn't it. I've never had anything like that in my life, and I have a lot of hair. So I experienced this myself. It's scary. It's troublesome. Some of it's vanity, I'll admit, but it's our hair.
Yeah.
So, but when I test, I would say always comes down to the thyroid. And what I've noticed I have to do is I have to pick up the amount of the product is usually a higher iodine product than what they're taking, or a different one. Sometimes if I'm using one product, I have to go to even a different company. If I'm using systemic formula, I have to go to standard process, or vice versa.
Yeah.
It's usually a change, and it's almost always up. I have to up it. And sometimes it's just one bottle we have to do, but it is required. And if you don't do that, not only is there hair loss, but the energy goes down. The energy levels of that person go down, down, down. So that's a little bit of a pickup, and it just helps them get over that post-COVID stuff quicker. And the hair does come back.
Yay.
The hair does come back, yeah.
So these people that are experiencing this probably had an underlying weakness in their thyroid,
Yes.
which they may or may not have known about.
Right.
Right. Some people may know, but I like to point out that people are used to, maybe from their medical doctor, hearing about, I have a thyroid disease, but there are underlying, I don't know, I guess I'll call it less than optimal functioning of the thyroid, which is the thing that what you do is best at picking up.
Yeah.
Is best.
Yes.
And that's really what a wellness approach is to pick up something, at a point where, first of all, much more easily can be done about it. We can fix things a lot easier at that stage. So
before they get bad.
But probably these people are ones that probably did have some underlying weakness before COVID hit, I would think.
Yeah. And I mean, we've talked about this. They can do a thyroid stimulating hormone, a TSH test. You could literally do that 10 days in a row and get a different answer every day, depending on how stressed the body is. it's just not a reliable test for the health of somebody's thyroid.
Thyroids are one of the things that blood tests are not the best way of testing.
Yeah.
They're just not.
And if you're going to do that, you want to do the full panel. You want to do all of them. There's like 8 things I like to see when they're going to do a thyroid blood test, if they're going to do that.
Yeah, it helps. But again, they really don't have medications for each of the 8 things. So,
no.
but it's not the best test for things for sure. So
So this is a way that we can, like you said, it doesn't have to be diseased. We'd like to not have diseased thyroid. So if we can get the thyroid before it gets to that state, it's a lot easier to fix it. And the way we do it, we can get to that quickly. I have quite a few new patients that come in and their thyroid will test stressed, and they're like, I wondered if it was my thyroid, but my tests always come back good. That I get it. It does, but it's an underfunctioning thyroid.
So what's heartening about this is that you've seen that this reverses.
Oh yeah,
it starts coming back.
I can assure you it reverses. Just let me know what's happening and we can take care of it. I can't just do it over a phone call or something like that. I have to test to see what the best thyroid support is.
Sure.
But,
it needs to be specific.
Yeah, it does. It is very specific.
Which is the case for most things. To get the best result. So we hope this information has been helpful. If you have any questions or want to reach out to us, you can by telephone, 989-732-7000, or through our website, www.sacswellnesscenter.com.